A week ago, my mother had a severe bout of stomach ache. This she had been having for a while, but we didn't realize the severity of it till she was taken to the hospital. And preliminary investigations indicated that it was a case of severe infection in the gallbladder. She had actually stones.
ये दर्द उनको पिछले हफ्ते ही हुआ, वहाँ काफ़ी सीवियर दर्द था और जब हम वहाँ पर इनको हॉस्पिटल ले गए, वहाँ पर इमीडिएटली इनका स्कैनिंग हुआ और तब हमें बताया गया कंडीशन थोड़ा बाकियों के केस से अलग है, तो इनको इमीडिएटली सर्जरी करना होगा। एक्चुअली हमारी मदर इन लॉ को पिछले कई महीनों से ऐसा दर्द होता था, पर वो बच्चों को तंग ना करें ऐसा करके वो एक नॉर्मल पेन किलर लेकर के अपना काम चलाती थी और हम लोगों से ये कभी नहीं बताती थी कि उनको ऐसे ऐसे पेट में दर्द हो रहा है। बट जब कंडीशन थोड़ा क्रिटिकल हो गया, जब उनके कंट्रोल से बाहर हुआ, फिर हम लोगों को ये पता चला।
मेरे पेट में बहुत दर्द हुआ करता था, तो मैं पेन किलर खा करके बर्दाश्त करती रहती थी, पर एक दिन बहुत जोरों का दर्द हुआ जो बर्दाश्त नहीं हो पाया, तो मैं डिसाइड की कि दिखाऊं डॉक्टर से। फिर दिखाने गई तो पता चला मेरे ब्लैडर में इन्फेक्शन है।
हमारा झारखंड में अच्छे सर्जन हैं, पर जो कॉम्प्लिकेशंस की बात उन्होंने बताई तो हम लोग थोड़ा घबराए। इसी क्रम में हमारे ब्रदर इन लॉ उन्होंने कहा कि आप कोई भी सेकंड थॉट मत दीजिए, आप लोग वहाँ से यहाँ आइए, हम आपको एक स्पर्श हॉस्पिटल है, डॉक्टर चंद्रमौली के बारे में उन्होंने बताया और उनका प्रोफाइल हमारे साथ शेयर किया। उस प्रोफाइल को हम लोग फिर गूगल पे जाके सर्च किए, हॉस्पिटल के बारे में जाने, डॉक्टर साहब के बारे में जाने और फिर हम लोग इमीडिएटली एक डिसीजन लिए कि अब हम लोग झारखंड में ये ट्रीटमेंट नहीं करा के हम लोग बेंगलोर आएंगे।
She needs to be taken to a hospital and to a doctor who I've had prior experience of and who I can rate as amongst the best in the country. And that's how she landed at SPARSH Hospital. At that stage, we never realized how complicated things were. But in the very first investigation that Dr. Chandramouli did, he indicated to me that it wasn't usual. It was actually quite serious. It was quite bad. And he said she needs immediate surgery. After that, it was up to Dr. Chandramouli. And I know how complicated this operation was. For something that takes 20 minutes, it took him 2.5 hours to get her to where she is today.
जो कॉम्प्लिकेशंस यहाँ मेरी मदर इन लॉ के साथ दिखा और जो मेहनत डॉक्टर साहब ने की, ये पूरा प्रोसेस काफ़ी लंबा चला। अब मेरी मदर इन लॉ बहुत बेहतर हैं और यहाँ हॉस्पिटल में जो हॉस्पिटैलिटी हम लोगों को मिला यहाँ के सारे स्टाफ से, जो एक कॉर्डियल माहौल है, तो ऐसा तो कभी लग ही नहीं रहा कि हम लोग किसी भी हॉस्पिटल में हैं।
She is healthy, she is smiling, she has been here for a while. There is some amount of pain, but you can see in her eyes that she is comfortable. And a lot of that comfort is not just the treatment that has been provided, but the support service and care.
इधर आने के बाद तो इतनी अच्छी यहाँ का वातावरण, इतना बढ़िया नर्सिंग, इतना बढ़िया हॉस्पिटल कि मैं आधी चंगी ऐसे ही हो गई। फिर ऑपरेशन के बाद मैं अभी बहुत अच्छा फील कर रही हूँ। पहले तो मुझे ऐसा लगता था कि मैं लैंग्वेज समझ नहीं पाती हूँ, कैसे काम चलेगा, पर ये नर्स लोग इतने अच्छे हैं कि मुझे समय पे कपड़े चेंज करना, बाल बनाना, दवाई देना, सारा देखभाल करना इतने अच्छे से किए कि मुझे पता ही नहीं लगा कि उनका लैंग्वेज मैं नहीं समझ पाती हूँ। वो इतने प्यार से सारा कुछ हैंडल किए, मैं इससे बहुत प्रभावित हूँ, बहुत खुश हूँ। बहुत अच्छे लोग हैं यहाँ के।
Every hour, every half an hour, there's somebody or the other who's coming to visit her, give her the emotional support, give her the medical support that she so requires. It's almost become a homely atmosphere, and those are the things that you look for in a doctor, in a hospital, in a disease which could potentially be life-threatening. And that's how you take patients out of that stage into a very healthy, happy living environment. So I remain thankful to the hospital, and I remain thankful to Dr. Chandramouli for how I've seen that difference in the last 2.5 days. The material change and the emotional confidence that my mother has today, I will remain indebted to the hospital for all my life.
I would like to talk to you about a small story of hope, faith and love, which is the tagline for our hospital. This is about an elderly, pleasant lady from Jharkhand who had a life-threatening condition which is brewing for the past couple of weeks. Unfortunately, this was something which could have turned to be a potentially dangerous situation for her. However, she had a hope in our abilities and put a faith in us, and I think we managed to execute this and save a life with a lot of love. This is a case of what we call an infection of the gallbladder, which a lot of people think this can be a very simple, straightforward, medically treatable condition. I think this is an opportunity for me to create that awareness amongst the general public to be vigilant about certain what I call critical symptoms. That means to say warning symptoms or the red flags. One of them is the pain in the abdomen, which is not relenting. It's meaning it is continuous, severe, on and off, or rather episodic. But with antibiotics, it gets better for a while and then it comes back with a vengeance. So these are the kind of symptoms which are the warning signs, wherein it's very important to get a scan of the abdomen and seek medical help. Gallbladder infection, or what I call cholecystitis or empyema of the gallbladder, is a condition wherein there is blockage to the outflow of the bile and the gallbladder swells up. This can go on for a while and the gallbladder fills up with pus, and especially in the elderly, this can be potentially life-threatening. But if detected early, more so in the case of diabetic patients, we can bring about wonderful outcomes by removing the source of infection or the source of sepsis. I think this is about this wonderful lady who put a lot of faith in us and said, I'm at your disposal, do whatever you can to help me. And this operation was carried out through keyhole, and she was cared for by a lot of staff in the hospital, including physiotherapists, anesthetists, and of course by our wonderful nursing staff. It's about teamwork. We all work as a cog in the wheel. So everyone has a role, everyone has to do the job, and we as doctors, yes, we are the directors, we kind of direct the whole sequence of events, but without the help of our staff and the ancillary staff, the nursing, the physiotherapists, our ward boys, this wouldn't have been possible.